And we're live on Facebook as well, Lorraine.
Great, thanks, Tony. Welcome, everybody, and welcome to the latest in a series of nursing updates that we are streaming live on Facebook and Zoom for people to join us. So for those of you that don't know me, I'm Lorraine, I'm the Chief Nurse, and joined here today by two colleagues who I'll let introduce themselves. So, Julian?
My name's Julian Hutter. I'm one of the Practice Development Nurses for Division A.
Lovely, and Fiona?
Hi, I'm Fiona Hamer. I'm one of the corporate heads of nursing, looking at assurance and digital.
Wonderful, thank you. And we're also joined by Tony, our comms lead. Tony, do you want to introduce yourself?
Hello, I'm Tony. I'm the head of internal communications.
Lovely, thank you. Okay, so today we thought we would just do an introduction, a short piece introduction to both fundamentals of care standards that have been launched across the organisation and safety huddles. So if we start first with the fundamentals of care, Fiona, do you want to just take us through what are fundamentals of care? What are the standards? How were they developed? Who were included in the development of these standards, and what our intention is? Please.
Absolutely. Thanks, Lorraine. So the fundamentals of care standards have come from a development called Getting It Right First Time campaign from the Royal College of Nursing. It was originally made for end-of-life patients, but actually has been rolled out in many trusts across the country. And this is around core standards of care, of how we look after our patients. We originally got some focus groups together with numerous members of staff, ward sisters, matrons, heads of nursing, and anybody else across the trust that could join, and really dug down into the standards of what it means for a patient within our services and how can we look after them to the best of our ability. So there are 8 core standards. We have designed them for inpatients and outpatients, because obviously patients in outpatients still require a certain amount of care. So they are things like nutrition standards, looking at how we allow people to access foods in outpatients, but inpatients it's looking at how we maintain nutritional standards, how are we observing that people need extra nutrition, how are we helping people to eat and drink. Communication, how do we communicate with our patients? How do we allow patients to be part of their care, and how are we really allowing them and hearing their voice across the organisation? Pain, again, how are we maintaining and looking after people in pain and making sure that medications are given in a timely way? Bowels and bladder, mouth care, personal hygiene, supporting mobility and skin integrity. In outpatient, skin integrity is not called skin integrity because these were also discussed at patient groups across the organisation. Patients really loved them. They wanted to be cared for in those ways, and they were really happy for these to be utilised. The idea is that there will be a poster which Tony will share with you all around what wording is within all of these standards that has been signed off across the trust. So it was developed by our staff and our patients, and it is just a reminder of how patients should be cared for on a daily basis, and just reminding us of those standards when we're in work.
Okay, so as you say, Fiona, real fundamentals is exactly what it is, isn't it? It's the fundamentals of good care, good basic care, and expectations that are from our patients, for our staff, and a really a good reminder for everybody around what the basic standards of care is that we should be given. Is that right? And written in a way that with our patients, by our patients, that they can actually understand.
Absolutely. So there's no jargon. The language that they want in there is absolutely in there. And we've designed them for the posters to be big enough to be able to, for patients to be able to see and read, and hold us to account for that quality of care.
Okay. And it eventually will be fed into our accreditation programme, which we will do a session on at a later date. So thank you, Tony. So this is an example of the inpatient fundamentals, Fiona. Yeah.
It is, yes. The poster is obviously a bigger size to this. The wording is of a size that people can read. It will be put up and either laminated or put behind a sheet so that it meets infection control standards, but it is around what care people should receive. Everybody can look at this. It's everybody's business. So, you know, if patients feel that they're getting poorer care than is on these standards, then we need to be holding ourselves to account for that, but also patting ourselves on the back when we do have high standards in all of our areas.
Yeah. So it's a good compact with our patients. This is what we aspire to do. So Julian, I think you've had some example or some experience, haven't you? Sorry, in Division A, where you have been trying to implement this or trialing these standards.
Yeah. So thank you very much. Hi everyone. We started looking at 3 wards in Division A to try and pilot the fundamentals of care kind of bundle. So we started doing some teaching, really. So we started raising awareness of the fundamental standards at handover. So myself and my colleagues went into the wards at handover and did a 10-minute teaching session on one of the standards per week, and we did that for 8 weeks consecutively. And it was a really good way to get some engagement. People knew the standards, people knew that this is what we aspire to do already, and it's nice to have some kind of framework and some formality to work within to try and improve that and really have a deep look into what we do and how we do it. So the teaching went really well, and it was a nice, we could get in, we found it was easy to get in at handover time. It was a nice time to be able to get people first thing in the morning before they go on to shift and start people thinking about different fundamentals. It allowed us to answer questions, and we also asked people to think about ways to document what they're doing about these standards. So getting that in from a really early point to make sure that we're really evidencing what we do. We signposted to the wider initiative. We asked people to familiarise themselves with the Getting It Right Every Time document and talked about this feeding into the ward accreditation programme, which is going to happen. And I think it's good to get people engaged with that. So we found that was really useful. We encouraged people to champion the fundamentals, think about how it affects patients, how are applying these fundamentals going to affect your day, your time management, your job management, and are there any issues performing them? And from that, we took on some value management boards, and this is something that Fiona and I have been working on, which just allows the ward to get some ownership of it. It's part of how we measure the impact of what we're doing. So they've come down really, really well. We were thinking about what is going to change. So once our programme of teaching finished over those 8 weeks, we then started looking at how we're going to implement these changes, how we're going to evidence them. And we've seen quite a lot of improvement that the staff have been reporting. Improvement in their documentation, in their initial assessments and screenings has been a really encouraging thing to see. We've put the value management board up on one of the wards, and we've had some challenges with staffing. We've had some challenges with people being able to engage with this programme, and I think we've been lucky in one of the wards to have some protected staff to do it. So one RN and one healthcare support worker have been given some protected time by the ward manager to implement this and to run the value management board. And we found that with that protected time, it's worked exceptionally well. And we've got a really good level of engagement. So that's really, really encouraging. For the other areas where we haven't been able to allocate that time and protect that time, we've had a bit more of a challenge in implementing the bundles.
Fabulous, thank you. So a couple of things that you said there. I mean, it's really important to say that this is what's in these standards is what we do already, but it's given us a framework, isn't it? And sharing that framework with our patients. Absolutely. Around the care that we should be given, but it's what we are doing every single day. Yeah. And it's good to hear, Julian, you're saying that it's leading to improvements. So that people Absolutely. Are looking at these standards and thinking, well, okay, well, there might be things that we need to do to improve on these standards. So that's really good to hear.
It's nice.
For those that don't or haven't heard the term value management boards previously, could one of you just describe what that means? What is a value management board?
Sure. Do you want to go, Fiona?
I don't mind. So.
Sure.
What we're trying to do is get people to have a look at the care standards that we have on the wards, any patient harms, what is happening on a daily basis, and really think about what we could do to improve. But not just saying we need to improve this, but what could we do? What are your thoughts about what we can do to improve this? And then really taking that forward. So if you say we've got a problem with X, you need to say, and I think this is what we should do. And then really listening to staff on the wards, whether it's a healthcare assistant, the ward manager, anybody that works in that ward area. And I know that some physios have been involved in some of this work. So it is about absolutely everybody just looking outside the box and having a real think about what we could do at ward level to change processes and make our patients even happier while they're in the hospital with us. So it's about, for me, it's about engaging staff in this process and allowing them to run with quality improvement matrix within the ward areas, and us really listening to their feedback about what we can do to improve things.
So a understanding of this is where we are currently, these are what our metrics are saying, and what can we collectively, anybody can come up with an idea or thought around how they can improve care. Julian, is that how you're seeing it?
Absolutely, and we're seeing that it's working really, really well. So on our area that's adopted them, for example, we've had a different way of working around skin assessment, heel assessments, and removing TED stockings on a daily basis. We've had some changes implemented already where nurses are using a board up in the bays to document when people's skin has been checked, making sure we're checking things every day, because we had an issue with skin and heels not being checked. So it really has worked very well in kind of turning that around and raising that awareness. Again, looking at analgesia being another one, patients not realizing that they could ask for painkillers, patients waiting for a drugs round before saying they've got a pain score of 8, if they could ask for some paracetamol 3 hours earlier. Empowering patients to do that is a really important thing. And so we've identified that on this clinical area as well. And one of the great things is that we've been able to share that best practice across the divisions. So we've been saying now to every ward, do your patients know that they have PRN pain medication that can be offered? So it's been really, really, really good.
And that's brilliant to hear, isn't it, that we are actually truly empowering the patients. And there's a comment actually that's just gone into the chat, which is somebody saying that this sounds really good. We're allowing ourselves to be open, honest and transparent with our patients and our staff. And that's what this is about, isn't it? But this is what we're aspiring to. And we need our patients to remind us as well. So that's a brilliant reflection, Julian. So thank you. Okay, so that's the fundamentals of care standards, and we're going to be seeing these posters out in the organisation and real information for staff and patients, and then we'll be talking more about the improvement boards or the value management boards, whichever we decide to call them as we move forward. Okay, and so if we move on then, so the other part of today's update is in relation to the safety huddles. So Fiona, do you want to just give us a bit of an overview of the huddles and how they've come about and how they're working?
Yeah, absolutely. Thanks, Lorraine. So safety huddles have again, I had discussions with staff about what they look like and why we need them. What huddles provide is an information giving exercise that takes 5 minutes. What we've decided to go with is morning, noon and night, and then one in the middle of the night because our patient population changes so quickly. What we want to do is really dig deep into what are the risk factors for that ward during that day. So what patients are we really concerned about? What's going on that ward that day that might impact? What does staffing look like? Are staff okay? And then the lunch one, again, is exactly the same process. So it's an information giving exercise. We also want, within part of this at the end of the shift, to do a debrief. Is everybody okay? Have they been okay during the shift? Has anything happened? Do we need to support you going home? but also a culture of really work it. So we start a shift together, we need to work as a team together, and we need to leave the trust together. And part of that is a catch up with all the staff, an hour or 2 hours, some people are finding, before the end of the shift, to make sure that medications are given, people's documentation is done. Because actually, if a member of staff has been off the ward for many hours, then they may end up going home late. And what we want to do is make sure that we can all support each other. But what this has done is it's the areas that we've trialed this in, it's really good for a communication piece. People are more aware of patients of concern that they're not necessarily looking after, but they are on that ward area, but also as a support mechanism for staff with other staff members, so that they can be supported throughout their shift. It's, as I say, it should be attended by as many people as possible. So at the moment, it's heavily influenced through nursing, but doctors, AHPs, some of our areas have actually had a conversation with their physios, and their physios have changed their break time so they can go, because they've said it's really important for them to be a part of this huddle process. And that's really lovely to see. But it is an information giving. And it's to keep our patients safe, but also to check in with staff to make sure they're okay.
So brilliant. So again, developed with our staff, with all of you out there, and really it's a safety huddle. That's a safety huddle for both patients and staff, to ensure that we are, as staff, we are also safe in our practice, and that we are feeling supportive. And I think we've heard more and more that people are, as we've had issues with our staff in numbers, more and more we hear that people are concerned that they're not getting everything done that they need to do in a shift, and they're not able to give the care that they need to, and they finish the end of the shift feeling that they haven't done everything that they could for a patient. So having these check-in points, these safety check-ins for each other, and ensuring, do you need help? Is there anything that anyone else can do to come in and support you? Must help, I'm sure, out there in the clinical shifts. And again, Julian, you've piloted these huddles in one of your areas. Do you just want to tell us how that feels, how that's going?
Yeah, so we've had some success and some difficulty in implementing the huddles, and I think really the timing is one issue that we faced, is where people are just too busy at the end of the day to get the safety huddle in, and it misses that vital check-in and the whole, one of the purposes of making sure everyone leaves on time, which is a really important thing. And I think, so that's been one issue that we've had. What it has done, we found, is really cemented the safety huddles that already went on. So the lunchtime safety huddles that were already part of the culture on 2 of our clinical areas, it really cemented the use of those, which was a really useful thing. So we've at least got one where we were having kind of a shaky. So it's just about looking to see where we can fit them in. And I think that's one of our challenges, is just seeing where the additional safety huddles can fit in. And I think there it's about looking at the safety impact and saying, the more of these you have, the easier potentially your day will be. And so it's just, there's a bit more work to do around it, I found. But fundamentally, I think it's quite well received.
And I think that it's great. I mean, these things do take time to come in and be embedded, don't they? They don't just happen overnight. And I think the important thing is to note that there's principles associated with these the huddles, for example, but it doesn't mean to say that one size fits all. So different wards will have different ways of implementing and embedding the huddles, and it might be that different times work for the different ward areas. Is that something that you think is true, Julian?
Yeah, absolutely. And it's the same in any clinical area, isn't it, where no two are identical. And so you're absolutely correct, it needs to be very bespoke to clinical areas, and it's another reason why it's really important that clinical areas own it and make it their own. And the more work you put into something like setting up and organising huddles, the more benefit you're going to reap at the end.
Absolutely.
Mm.
And there's a lovely comment that's just come through on the chat actually from Layla, saying that it's a fantastic way of providing ongoing support, and I would imagine very reassuring for new team members and newly qualified members of staff.
Absolutely.
Because yeah, I mean, 12 hours is a long time to be on a shift, not having good communication or not being able to communicate and do a bit of a check-in. And with everybody working, head down working, you sometimes forget to do those check-ins with each other. So yeah, it'd be interesting to see if there's any feedback from students or newly qualified or new starters into the organisation. I don't know, not to put you on the spot, but I'm not sure if you've heard anything back, but if not, it would certainly be worth us looking at that, wouldn't it?
Yeah,
We've had some good feedback from bank and agency staff feeling very involved with the wards with this process. And actually, because at the moment it's on paper, it will be going electronic. It was it needs to be built into one of our electronic systems. But what it does is it allows people, if they come on shift at a different time than the huddle is, to catch up with what is actually happening around the ward area. So they feel instead of trying to chase down whoever's in charge who may be busy at that time, they've got that paperwork that they can go to and have reference to. So that has really helped.
One thing that we also hear from our staff is that they often don't get time for breaks or to have drinks and to look after themselves, which is so important. Is that something that is going to be discussed within the huddle as well, to make sure that people are getting time away from the clinical area?
So yes, it is. It's also in the handover process as well. So some people are discussing it outside the huddle as part of a handover process. Some are doing it in the huddle, and it is about saying you need to have a break, and if you can't get a break, come and tell me. This is the staff safety and well-being factor of this is hugely important. Yeah,
brilliant. Okay, so they are the huddles are coming out across the organisation. There we go. We've just got a comment from Hayley to say that nurse apprentice just about to qualify and have found the huddles amazingly supportive.
Really good.
Yeah, so that's good to hear, isn't it? Amazing.
Absolutely.
There's more. Amazingly supportive and reassuring. I've had my management placement on D2 and the huddle is well used at lunchtime and everybody engages well with it. So that's fabulous. Thank you, Hayley, because I think that's good feedback to have, isn't it, for new staff, and really shows the value for us to roll this out across the organisation. Okay. Right, so I think that's our time, and so massive thank you, Fiona and Julian. It's really good to hear. If people want more information, Fiona, do they come to you?
Yeah, absolutely. Just get in touch with me or Julian. I'm sure we'll be happy to support people of the implementation. There is an implementation meeting next week, so if anybody wants to come to that and they haven't got it in the diary, please just let me know, because we really want to support areas going forwards with this and give you as much support and training and anything that you need for both of these aspects.
Yeah, and that's for any level of staff. I think that's something really important, isn't it? This isn't just for senior staff.
Nope.
Please do come and please do get involved at whatever level you are in the organisation. So
absolutely.
Fabulous. Thank you so much. And thank you to people out there joining in with the Zoom and the comments. That's really helpful. I hope that you found this session useful. As I say, we'll keep them quite short, and we will be doing future sessions on the ward accreditation. We're also open to any other suggestions that you may have for us that you'd like us to cover. So massive thank you to everybody, and have a good day. Thank you. Bye.
Thank you.